thing. Well, good morning. Um, the thing that the subject that I want to talk about is about photojournalism and how we photojournalists are now dealing with the problem of the coronavirus. How we are now working in the coronavirus crisis, and I think that it is a very important issue right now that we discuss how we have been doing a few things that we maybe normally do around. The yesterday I made a conversation here. I made a talk here on my YouTube and my Instagram channel, talking about the frustration that I'm feeling right now. That me as a photographer, I'm here in Italy right now, in a very small town of 22,000 people. We are 22,000 people here, and the city is in a curfew. In a curfew, we can't go out, and no one can come in. It is extreme measure. In a like whole Italy is in a curfew. No one can come in, and no one can come out. But inside Italy, the city where I am right now is in lockdown because it is expected to have a mass outbreak of coronavirus here in the city where I live now. We are 22,000 people, as I said, and we have right now about 90 something confirmed cases of infections. But we do as well. We know that there are many people inside their homes right now with the symptoms, but not showing the symptoms, but they know that they have coronavirus, or they suspect that they have coronavirus. They haven't been yet tested, but some of them are very mild symptoms, but some of them are also having heavy effects of the disease in their bodies, and that they are just waiting for, yeah, reflexly. They're just waiting for, no, the reflex. They are just waiting for the ambulance to come and to pick them up in their homes. And I have been trying to work here in Italy and in the city, because there we have a hospital, and this hospital have been closed because a few weeks ago a doctor and his wife, they knew that they had the coronavirus, they knew that they were infected, and they just entered the hospital without going through the triage, and they ended up infecting the entire hospital and most of the personnel in the hospital as well. So the hospital ended up closed because there was dirt infected, and because the personnel was infected, and then no one was there to run the hospital itself. So that was a problem. And then now the hospital is reopened, and we are hoping that the hospital here can serve to help the people of the city that most need assistance right now, and there are many here. So yesterday I went to the hospital, and I stayed in front of the hospital just waiting. I didn't enter the hospital because I know that the hospital is very contaminated, so I never entered the building itself, because they have a tent outside. And inside the tent, outside there, I saw that there was an ambulance that was going out to rescue some patient. And I talked to the doctor, and I said, listen, can I follow you? And the doctor immediately said, no, you can't follow us, because we need to preserve the privacy of the patient. And I know that, of course, the privacy of the patient is extremely important. We professional journalists, we are used and trained actually to do this, to do our job as well as we can, as to promote them, to bring out the information, and of course preserve everyone's dignity, everyone's privacy, and so on. And of course, in a situation like this one right now, we can't just like getting too close of everything that is happening, because that we know that our interference there can put the doctors at risk, and of course can put us at risk at the moment. And okay, so I accepted what the doctor said, because in a situation like that, the doctor is the most important authority in that field. So if a doctor tells you, I mean, I've been working in war zones and in a hospital in war zones, and when a doctor tells you that no, right now stop, you just stop. You never discuss with the doctor. You never like confront a doctor, because in the end of the day, their work is the most important work that someone needs right now. My pictures at that moment, at that place, won't save lives, but the work of that doctor and that nurse and that ambulance driver, this work, they will save lives. My pictures won't save life there and now. So I just accepted what the doctor told me to do, stay here. And later on, I went to the Red Cross, the local Red Cross office, to see, because I mean, I want to do this work, documenting the sick people, of course, but I also want to document how the people that are not sick, but they are at home right now and they need assistance, how are they getting assistance? Because there are many elderly people living in homes. Most of the elderly people here in Italy, they live with their families. The families are very welcoming to take the grandparents, grandparents in many cases, to live with them. They have normally a part of the house, just like separated for the elderly. So, but there are a few cases there, of this kind of people that are living alone because they don't have a family. Maybe they didn't have children when they were like young, and today they live alone. And these people, they need help. And the local Red Cross is helping these people. They are bringing medicine. They are bringing even like groceries. They are going to the supermarket to buy groceries and then to bring them home. So I wanted to work and document that Italy, and how these people are being taken care of. And suddenly the local Red Cross, they told me that there is a national um, um, decision of the Red Cross, the National Red Cross, not to allow journalists to follow their work, to see the things, so to see what's happening, even if it is like I said, wow, I'm just like trying to see they helping people and simply bringing them medicine or food. What is about secrecy? Which is the point of making secrecy of that? So I was wondering, and then I came to a point that I realized that the entire crisis, the entire coronavirus crisis, it is a crisis that we know about. It is a crisis that the journalists have been working on it for a long time now, since the beginning. Actually, the journalists have been in the front line of that some people have said, the journalists are not saying everything. And then other people said, no, the journalists are, exaggerating. Is an exaggeration of them. It's not a big problem, as the media say, like President Trump said, and Bolsonaro said. It's not like the media says. But some other people said, oh, it is worse than what the media is saying. So we should be prepared for something really even worse than that. So, but if you read the stories, you can see stories, many stories, written stories and video of it. But we can't see pictures. There are no pictures. Most of the pictures portraying the coronavirus are pictures of, and excuse me, I'm not with coronavirus, just saliva. And it is like the coronavirus. It's there are pictures of empty houses, empty streets, empty towns. You see how Italy got empty, how Venezia went empty after a few days, how, New York today, there are no people on the streets, how, Barcelona is left alone, all this shit, excuse me the word shit, but it's all this shit about how the cities went empty after just a couple of days of crisis. But we don't see the pictures of the victims. We are not seeing the real problem of it, And yesterday, a friend of mine in Brazil, she sent me a picture of an Instagram picture of Ghanaian. I think he's from Ghana. I never heard of him before, but I see that many of my friends know him. A photographer from Ghana called Nana Coffee Aquaha. I don't know how I pronounce his family name. I'm sorry about that, but he wrote in his Instagram post like over 3,000 deaths in Italy, yet no graph photos of the dying or dead. Dear white photographers, can you photograph Africa with the same level of respect and empathy? Dignity is fundamental, human right, not the privilege of the few. And then, I find it really funny because he writes by hand, Nanakov Aqua, like, his signature. Wow, very important. He feels to be very important saying that. I would say like, first of all, I disagree totally with him. It's not that we are not photographing the graphic pictures, because no good photographer, no responsible photographer, at least all the photographers that I know, that I work with, that I respect, that I, the tradition of this kind of photojournalism, of people that risk their lives to go to places and show what is happening there. I never met someone that went there to make graphic pictures. First of all, that's the first point. I never went to Libya. I never went to Iraq or whatever, to make graphic pictures. I have photographed my country, Brazil, my birth country, Brazil. And the pictures that I have from Brazil, they're violent. I never try to spare Brazil from showing the violence that Brazil has just because I was photographing my own country. Because I was photographing maybe, my people. Or they will say, oh, yeah, but you were photographing the black people, you were photographing the poor people. Well, I was photographing the violence of my country. And many of them were white, many of them were black, most of them were poor. Yeah, but that's where the violence were happening. That's what, because I think that this one point of photojournalism, you have to be in the place and the moment where the things are happening, then you can do photojournalism. And then I would invite Nana Coffee Aqua, if he's really interested or wondering about why these 3,000 people, in 1,000 more people that died, why he's not doing the pictures. He could have been doing the pictures, because right now things are going to go really, really bad, and we need the pictures that can show the picture, to show the population what actually is happening here. I'm not saying that, let's go do, as he mentions here, graphic pictures, but we have to do the pictures that can show to the people that this disease that we are facing now is not just a flu. It's not just something that people can, it's just like a flu. In the worst case scenario, you are getting a really bad flu and you stay at home for a few days and then you are fine. That's not what's going to happen. We are facing a problem that is much bigger than that. And at the same time, he has, he's right in one point. He's right in one point. Why? He may be right in a point of questioning, why are we not seeing these pictures? Why are we not seeing these pictures? And then, the only answer that I can find in myself is like, not the photo editors, because yesterday I was talking with a friend of mine, a photo editor from a big newspaper. I'm not going to mention her name because I didn't ask her permission to mention her name here, but she's the photo editor of the photo editor. She's trying to find the pictures that can illustrate the real dimension of this problem, the human dimension of this problem. Because until now, people are just talking about the economical part of it. We are going to lose billions. The world economy is going to break down, and some people are actually feeling happy about that. But she can't find any pictures that can actually show the real human costs of this disease. And then what happened? I was talking to her, so the only answer that I could find for this is that maybe the governments are trying to prevent people to collapse in a kind of a fear, a panic, because we have a pandemic, but people because there is I think that I have heard maybe every politician are saying, don't panic, do not panic, do not panic. It's all the time, do not panic. And then in the end of the day, they say, okay, maybe, if they start seeing the real dimension, population will panic instead of taking action of doing the basics, which is staying at home. They will panic now if they see Norwegians, white Germans, Americans, whatever, dying, because they say, there is this myth that says, oh, 80% of the contaminated, infected people, they actually take it well. Well, where are the pictures of the 80% people taking it super well? Where are the pictures of these people? We don't see. We are not seeing it. I mean, you see people posting on Instagram or this TikTok thing, whatever, dealing with their quarantine. It's became almost a cool thing today to have a cool recipe for how to endure quarantine. But the fact is, we have thousands of people that are dying. We have even more people that need right now intensive care, and the politicians are keeping, oh, don't panic, don't panic, don't panic. Of course, we shouldn't panic, but I don't think that preventing people of knowing what is actually happening make them is a good strategy. Because in the end of the day, we have still today, thousands, millions of people, actually, not thousands, millions of people that do still not believe in the disease. They still do believe that we're dealing with something that can be, oh, if I get it, then I got it. Fine. In the end of the day, the entire world will get it, so it's fine. So I think that it is very important. And then a few days ago, I saw groups of photographers. I have been invited to be among a group of photographers that can document it on Instagram. And I went to see, all the kind of pictures that people are actually doing there. And then you have, again, pictures of empty streets. You have pictures of people at home. You have, a few pictures, whatever. Man, honestly, let's talk honest right now. This is not photojournalism. Photojournalism right now is we are dealing with something really, really, really dangerous. And many people, when they ask me, they want to do war photography, hey, how can I get to Iraq? I tell these people, hey, what do you have to do in Iraq? How long have you been working as a photojournalist in your own community, your local newspaper, in your national newspaper, before you felt oh, I'm professionally ready to go to a war zone and then to document something very specific? And the answer is, most of the answers are no. I just feel okay, I'm a photographer, I'm a good photographer, whatever, and we have to do photojournalism. And in this kind of situation right now, that people have to stay at home, because if you don't stay at home, you will probably get sick, and then being sick, you will actually make other people get sick as well. So this, and then I think that to get out of our home, our homes, from our families, to risk to be sick and contaminate our own families, and then to contaminate people that we love, we need to have a real good reason for that, which is, let's do a work for that. Let's promote it. Let's publish it on a newspaper. The newspaper are eager now. I know that the newspapers, they need pictures of what is happening. So Instagram, I can make a picture of here on my balcony. Oh, hi, how I am dealing with the coronavirus quarantine. I do it here. Me, cutting my toenails. Oh my God, that's. I mean, for me, it's not what we are talking about. Well, I think we have to do the work of what is happening now, and then to do the work of what is happening now, we need to be professional. The world right now needs professional photographers. We don't need Instagrammers. I mean, I'm talking with you here on Instagram, but I'm not a fucking Instagrammer. Whatever. And but we have to confront why. It makes me really. Yesterday I was reflecting about why, for example, white photographers from Europe, from the United States, everywhere. We went to Africa to document the Ebola crisis. No photographer went there, made all the pictures that we did. We made. And hey, Roberto, come stai? Come stai lì a Napoli? And we made all the pictures of the pictures in the Ebola crisis. No pictures. I never saw a graphic picture. I saw real pictures of people going there, people actually dying. And it is something very important that people should understand. The fact that you die, that someone dies in a violent situation, it doesn't make his death undignified. On the contrary, the victims, every victim that died for something like a disease like it is now, or a war, or victim of something, the death has been dignified. The victim is always dignified. The ones that trying to hide what is happening, the ones that killing people, the ones that providing weapons, these are the people that have no dignity. The victims have always dignity. And then but this Ghanaian guy, let's talk about him again. Well, he's right. Why he's seeing the pictures of the victims here? Why can we make, for example, the pictures from Africa, from Iraq, from elsewhere? These pictures, we can make art of it. Well, they are so good that we can make even art of it. But the pictures, if we make the pictures here, then, well, the pictures will create panic. So, I think this is completely unbalanced. We have to find a way that we can make the pictures here that are essentially good enough for inform the people that we are actually dealing with a problem, a real problem. It is not a fantasy. It's not something that you are going to take some paracetamol and then go away with it. If you get sick, you will need like intensive care attention, and you probably, if you survive, you are going to survive with a long-lasting, lung disease, or, so, and I've seen like photojournalists today, like the newspaper. I have been contacted by a few newspaper asking me, hey, can you make pictures? And then I said, okay, good. Of course I can make pictures. And but then I said, okay, a newspaper wanted me to go to Rome a few weeks ago. And can you go to Rome? And then you try to go to Lombardy, where is the place that is surreal, like in the rest of it, even if there are still so many people going around. To come stai? Yeah, here, we are closed. Adriano Irpino is locked. No one can come in, and no one can get out. So we are. Hey, Roberto, that's you here, man. That's a picture of you here. You remember in Tunisia, and they ask me, "Can you go to Rome?" I say, "Yes, of course I can go to Rome. I can go to Rome." But then I said, what if Rome or Italy or my city elsewhere gets locked? No one can get in, no one can go out. And I am in Rome, and then I can't like say, hey, knock on a friend's door and say, can I stay in your home? Because today you can't ask someone to stay in their home because everyone is protecting itself, everyone protecting their families. And I know that I wouldn't be able to knock on someone's door and try to stay there because if I have to stay there for a month, living in a hotel, can you cover my hotel expenses? You know, and so on. And of course, you have as a professional photographer, we have to be honest with the editors, saying, well, I can do this work, but there are risks involved, and those risks are not just like my health. The risks are also involved. There are also economical risks because, like for example, I don't have a family in Rome. I don't have family. I have friends, but let's say I'm in a hotel and then I get infected. Who is going to take care of me in this hotel? Who is going to make sure that I have the proper assistance there? If I get sick, I can't go out from my room in the hotel to buy food. For example, let's say I have a mild symptoms of the disease. But if I get really sick, who is going to take me to the hotel? I'm sure that the hotel won't like to have me there sick, to have a sick person in their room because that would like the entire industry today, the hosting industry today is completely on breakdown. Imagine if you have a hotel that has to be closed in quarantine because one guest destroy the hotel's reputation, the hotel economy, and so on. So who would take care of me if I find myself in a situation like that? So I was honest with the newspaper, and then we decided not to do the assignment. That's it. But my point is, like, I think, if you are a professional photographer today and you are thinking of photograph the coronavirus, we do need, I think that the world right now do need like professional photographers doing this work. And I think we will deal with a kind of secrecy that I can't understand because, like I said yesterday, the Red Cross here denied me access to them delivering medicine or simple food to people living alone in their homes because they don't want to show what is happening. And the doctors are not allowing, the hospitals are not allowing journalists inside, and so on. So what's going to happen now? I know of a photographer that I'm not going to mention his name as well, but is a very good friend of mine, and he works for a big agency, big agency like a wire agency, and he has been working. He went from one war to another war in just recent weeks, and then when he arrived at home, his agency was saying, now you have to work. You have 2 days to get ready to work on the coronavirus crisis. So a few photographers are like, if you work for a big wire agency today, they don't have time to rest. They go from one war because let's remember, we had the Libyan war, we had the migrants crisis now in Turkey and Greece. We had the Idlib war, the Idlib offensive. We had so many things. So these people, they've been working all the time, and then they don't have anyone to cover them, because the agents, these big wire agencies, they are not actually hiring anyone new to say, oh, we are exposing our photographers under too many circumstances of risk. We are putting them under too many circumstances of risk. So let's spare a photographer that right now has been working in Libya, and then not making him to work in a situation like the coronavirus crisis, because in the end of the day, in Libya you can die if a mortar lands on your head, or here you can die if your the immune defense system is weak. And this is a real problem. At the end of the day, what's going to happen now? We see a crisis that we know about, but we don't see the consequences of it, which I think is very, very, very a big problem, very problematic, because what's going to the world think? The world, oh, this is a crisis of empty streets. Well, fine enough. This is a crisis. The worst case scenario right now is that selfish people will need to learn how to stay at home, and that's it. That makes no sense for me. I completely disagree with this Ghanaian photographer. Again, his name was Nana Kofi. I completely disagree with him. I think that he's just trying to get attention by blaming white photographers for not doing a proper work here, because I would say, why I would never, I would never, 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 never say why black photographers in Africa are actually not photographing the real problems of Africa, just because they are black. Because I know African photographers, especially in Somalia, that are really like in the front line of showing what's happening in Somalia. I know real people there doing a proper work. I would never, mention that because a photographer is white or black, he or she is not doing the work properly. I think that we have to do the work properly here in Europe, in the United States, elsewhere, and then actually start to think that show the people that the real dimension of this problem. And I don't know who I can talk with, because I've been trying to get access, and there is all this misinformation war. People don't trust journalists anymore. Like, for example, today you can see in a social media campaign all around the world. I have seen all doctors from everywhere in the world. They are doing the same campaign. They put themselves together, holding papers saying, "We stay at work for you to stay at home. We stay at work for you. Please stay at home for us." Well, you know, well done. But for the governments to believe that simple viral campaigns of doctors holding the papers will actually educate people to take this problem seriously enough, I don't think that's going to happen. I think that people will take easy because they are not seeing what's actually happening. And it's time for, again, professional photographers, professional photojournalists to take responsibility, to talk with their editors, because there are still many good editors around. And the newspapers, I know that the newspapers, they don't have money, they don't have stuff. They even today, this, I think this crisis is showing how everything has been doing wrong recently, because many newspapers that I know about, they change it. They changed all the organization structure inside the newspaper, and then today you don't have actually people inside that is able to take decisions, to make decisions. Here in Italy, I think that many photojournalists are doing a great job. At the same time, for them, it is getting more and more difficult to document. Many times they are verbally harassed. Exactly, Roberto. It's exactly what happened to me here in Ariano Irpino, and it's exactly what that's what I'm talking about. Hey, I think, Amen. Do you want to join the conversation? If you want to join the conversation, send me send me a request to join the conversation, and then I add you in the conversation, because I think it is important, because Italy now is in the middle of this crisis, and Roberto is an Italian photographer, and no one better than him to actually, talk about the problem. And by the way, he's a male and white photographers as well. So, Roberto, if you have the opportunity now, if you are at home and you can talk, just send me here a request, and then I will add you in the conversation. And that this is this is a problem, like how we photojournalists today, professional photojournalists, can work. Roberto is just saying here, Italian photographers are trying to do a work. I know of many. Gabriele Michalizzi is trying to work in the north. Francesca, I forgot her family name. I know. This is a thing. I know of Italian photographers that are not doing anything just because they are thinking about their parents. Because say, my father and my mother are too old. If I get sick, I can spread the disease to my parents. You know, people are taking responsibility, thinking, people are taking responsibility. We are doing the work as well as we can, but I don't know right now how is going to be, for example, in United States. How is that going to be? We have a government there that have been denying they have been denying the existence of this disease. Or reconnecting. The internet here is not working properly. Wait a moment. I don't know if yeah, there is back. It's back now. So in the United States, in Brazil, and many places, we have governments that have been denying the very existence of this crisis until now. And then, do you think that they will allow journalists, like the government will, will write down permission for journalists to enter hospitals to document all the mistakes that they have done? They will, like here in Italy, for example, the government is doing right now a good work. I would say that the government is actually taking care as well as they can for what is happening. But in the end of the day, they too denied it for too long. They too had to wait the situation to get worse enough before they could actually start to taking action. So it's very easy to say, to think, if I allow journalists right now in the hospitals, or if I allow journalists to work freely, the people will get in panic. Let's blame the panic for not allowing journalists, for not that they are like stopping journalists properly. Maybe using the wrong words here, but they are for sure making the work of journalists quite difficult. That, at least this is the feeling that I had from yesterday, and from the days that I've been trying to work. And do you think that it can restructure our society soon? Christian Medeiros, well, this is a big question, man. This is a big question. Everything that happens, it's somehow a way to make changes in society. I think this is a big question that no one can actually, you know, um, foresee or give a proper answer for that. I think any answer for that would be too shallow. As deep as someone tried to answer it, it would be probably too shallow. May be interesting, but shallow. And so anyhow, people, what I wanted to say here is how important it will be now for photojournalists to do proper work, to get in contact with the newspapers, to get in contact. We professional photojournalists, we have the contacts. It's not because of we don't have contacts that we are not working. We have the contacts to work. I produced something here. I wrote a text to a Brazilian newspaper, sorry, to a Brazilian magazine, Veja, that's going to be printed now in the weekend, today and tomorrow. And but I could make pictures, and I'm a photographer, not a writer, and that makes me think that okay, it's not enough to have written articles about it. It's not enough to have pictures of empty streets of this crisis. It's not enough that we make an Instagram uh, Corona whatever, and it's time for professional journalists, photojournalists, to take a position and then act. Like what shall we do? I don't know. I just opening now the debate about that. I hope this video, you guys know that I'm sometimes getting inflamed by the situations, but yeah, anyhow, if you have suggestions, if you guys, my friends, the professional photojournalists that are facing harassment, as Roberto mentioned that here, that Italian photojournalists, I will read it again. Here in Italy, I think that many photojournalists are doing a great job all the time. At the same time, for them it is getting more and more difficult to document. Many times they are verbally harassed. Yeah, so we need to take I think a position about that, and we need the photo editors to be on our side. We need the newspapers to be on our side, and we need the agencies, the job givers to be on our side. So if you have a comment, leave your comment here, or send an email. Let's debate about that. Okay. Thank you very much. Goodbye.